Tonight, children's hospitals are feeling the brunt of the nursing shortage as home care nurses continue to leave the industry. Good evening. I'm Vanessa Rufus.
And I'm Fred Shropshire. Medical experts say many are underpaid in a segment of healthcare that isn't widely known and competes against hospitals and long-term care facilities where nurses are paid better. It's even causing a delay in some children getting discharged.
WCNC Charlotte's Colin Mayfield spoke to a mother who is struggling to be a mom and give care around the clock. Colin.
Fred and Vanessa, it's a tightrope act that this mother of three is doing nearly every day, caring for three medically sensitive children. The family had 4 nurses at the beginning of the pandemic, but now they're down to 1.
I can't be Annabelle's mother. I have to be her nurse.
A mother's love knows no bounds. It's something that Judy Jenkins lives every day. She's a 78-year-old mother taking care of 3 medically sensitive children with her husband.
When we started this whole thing, we never dreamt that we would have an issue not being able to get nurses.
Jenkins says before the pandemic, 4 nurses would help her daughter Annabelle, covering 168 hours throughout the week. Now the family has 1 nurse 3 or 4 days a week, covering 48 hours, with Jenkins herself covering the rest of the time.
Gas stations are paying almost as much as they're paying my nurses to come and take care of my child, and they have her life in their hands.
She says she can't be the mother she wants to be, administering feeding through IV, helping make sure the ventilator that Annabelle is on works, all while trying to keep her little girl happy. The family lives in Texas, but it's an issue seen across the nation.
We can't find enough nurses to be able to fulfill the hours that the hospitals and the state has already approved is needed to take care of the children in their homes.
Sarah Walmsley, who works for Thrive Skilled Pediatric Care, says it's all about competitive pay in a climate where people are being paid more at places like gas stations and fast food joints.
We have lower reimbursement rates than what you would see in hospitals or long-term care facilities. And so we don't get paid from state Medicaid well enough to be competitive with those facilities.
She says Thrive provides care for more than 120 children throughout North Carolina, 40 specifically in the Charlotte and Hickory area.
And we work really closely with Levine's Hospital, Children's Specialty Hospital, because they're busting at the rims as well. They need more agency, more nurses to be able to take care of these children so we can get them out of the hospital.
An ongoing struggle with medically sensitive kids hanging in the balance.
I'm not the only mother out here going through this, although I might be the oldest.
So part of the problem is that home nurses generally get paid $30 to $45 an hour, where at hospitals, nurses can make up to $70 an hour. In North Carolina, Governor Cooper's proposed budget includes a plan to increase pay permanently for nurses who work with vulnerable people and in homes. Fred, Vanessa, back to you.